So many women's health topics are not a priority in medical training, and therefore our patients, half of our population, women, are not getting proper education, counseling, and medical evaluations and treatment for significant issues having to do with women's health. One is breastfeeding. You hear me talk about this a lot. We do not prioritize that, and most medical people really are at a loss when they need to handle more complicated breastfeeding problems that arise. The second one is menopause. So menopause is really not taught, maybe a few little details, but for the most part, menopause is not taught in med school or residency. And women are not properly given anticipatory guidance. They don't know what to expect when menopause happens. And then they are getting quite a bit of misinformation and non-evidence-based recommendations on how to treat their symptoms when they are going through menopause. So that's number two. The third is sexual health. Now, this, of course, applies to men too, but I'll tell you, my son had sex ed last week, and according to him, so boys and girls were separated, and with the boys, they learned essentially boys' anatomy. He said they maybe spent just a couple of minutes on girl anatomy, but 90% of what they learned was boys' anatomy. Well, don't boys need to know about girls' anatomy too? I don't know that it's necessarily uncomfortable to talk about it at this young of an age, when the only thing that makes it uncomfortable is that we make it uncomfortable. And we don't know, so we can't teach our kids. So this has been just perpetuated. People don't know the anatomy. They don't know how to name the anatomy. And this leads to a lot of problems when it comes to sexual health, sexual satisfaction, intimacy. And so everyone, girls and boys, needs to learn the anatomy, and medical people need to learn about sexual health, be more comfortable with it, and be able to discuss it with their patients from teenage years or preteen years even on, and that will help down the line. So many things not valued regarding women's health in this country, and it needs to change. And thankfully, there are a lot of people now working on this to develop some amount of change, but it is slow going, and we women really need to advocate for ourselves and get better care for women's health issues.